The problem now is people take PrEP. They are only focused on HIV. They forget about the other STIs, gonorrhea. If you are taking your treatment correctly and the virus is so low, it's undetectable, there is zero chances of you transmitting.
To even your baby, right? To even your baby.
Yeah.
There we go. See, and you can live a normal life with HIV. Welcome back to yet another episode of The Wellness. My name is Kakhalo Putwani and I am your host. And today we have a very interesting topic. We'll be talking about HIV and TB and its effect on our communities. Wellness champ, tell me about some of the misconceptions that you've heard about just TB, HIV. I know one of mine is as soon as you feel better, you can stop taking your medication. And a lot of people actually do. And you should finish your course because you build up resistance. So what are some of the misconceptions that you've heard?
There's just so much to speak about based on this topic. But then, I guess, since we have our expert here, I think it will be very much easier to just give them the platform so that he explains. But then we all know that, people lately, they are no longer fearful of HIV. So there's just so much to speak about that, but then I think it would be best that we give our guest the platform to just engage him and see from the expert themselves, because I have so much we'll share as we go throughout the show.
We definitely have a lot of questions. Joining us today is Thabo Mhlongo. I'm going to give him an opportunity to introduce himself.
Thank you. Hello. My name is Thabo Mhlongo. That's the name that my parents gave me. My mom also told me that I belong to the Mhlongo family.
Hello.
So I am a nurse by profession, a professional nurse, and I've been in the wellness space for quite some time now. So I can say I do have a bit of knowledge that I would like to share, and possibly answer some of the questions that you guys might have.
100%. Thank you so much for joining us. We really, really appreciate it. So before we get into our topic for the day, right? Mm-hmm. You're obviously a male nurse,
yes.
Right?
Yes.
And that's not the most common thing in the world, right? Mm-hmm. Please tell us just about your experience being like a male nurse when you come up and people go, well, would you look at that?
There's so much stories about that. But when you are a male nurse, people always think that you are a doctor.
Sure.
And especially in the clinic space that I'm at, there's nurse clinicians and doctor clinicians. So that causes even more confusion. But there's differences. All people, especially the old people, always confuse a male nurse for being a doctor.
Sure.
Yeah.
Sure.
So you always call the doctor.
Yeah, I'm always called a doctor, and I don't like taking credit for something that I'm not. Or the other thing that people say, they always say sister.
But technically though, guys, wait, hold on. Hold on. Technically, we were told a nurse is sister. So sorry, sister. I work in the health space as well, and I genuinely call everyone that's a nurse. See,
yeah.
Because I don't think it's a sister as in females. It's a sorry, sister.
It's like
maybe you can just
actually, because I think a lot of people do it.
I don't know, but then from what I've heard from people, some guys who are male nurses, they also get offended. They look at it differently, but then maybe if you could just explain for us what, how is it, you just explain regarding the sister thing.
Isn't sister a title though? Is it not a title?
I think people confuse that to be the title because nursing is the title.
Okay.
But you remember when nursing started, I think it was mostly females. It was a female thing. It still is mostly female dominated. So hence the misconception of if you are a nurse, you are a sister. It doesn't mean that if you go to the toilet and you stand. Yeah, well,
Are they not supposed to call you brother?
yeah, well, but for professionalism in the profession,
Yeah.
mainly we call ourselves sir. So
Sir.
Sam Mhlongo. That's what I'm called, because even like in the midwifery space, because you know when you are doing the nursing profession or the nursing course, depending on which branch you dive at, you can also do midwifery, like
Yes,
help
yeah.
pregnant mothers through the journey and help them give birth. So for us males, we are called a coaches. So that's the
You're
professional
called
title.
what? A coaches.
Yes, a coaches.
Hi, Bo. Have you guys heard that word
Coaches. Yo,
before?
that's the
I
first
I
time
thought
I'm
like
hearing it. Yeah,
okay.
Exactly. So
A
it's not
coaches.
like this is a midwife and you can see it's a man. I'm a man. I'm not a midwife.
But you're gonna help me give birth.
I'm a
like
coacher.
a coacher.
Yes, that's
And
the
a
professional
coacher.
title
Oh,
for a male nurse that can help you give birth.
that is so interesting. We definitely live and we learn.
Yes.
And it's so interesting that both myself and our wellness ace are in the professional, like health professional setting, but I didn't know that.
Exactly.
Yeah.
So,
I wonder what's a male gynecologist. If ever
How are they a
there's something-
gynecologist?
Gynecologist, because like I feel like a lot of people look at gynecology as a female a profession. I was also like shocked when I saw like a urologist who's a female. I was like, okay, there's a group of doctors here in this particular place, and then it's only males. So when I saw this one woman doing urology, I was like, yo,
You were
this
shook.
is interesting. Yeah, but in any case, I guess the professions are all for unisex. Yeah.
I think for the most part.
Yeah.
So I want us to take a few steps backwards because this is an interesting conversation. But I want us to go back to talking about HIV and TB, right? I think a lot of us feel like we know enough about HIV. We know somewhat about TB, right? But I would like for you to talk to us about the implications, especially for young people in our communities, right, of contracting HIV or contracting TB or contracting both.
So you want to know the
Like what happens when, like to your body, to your health, to your mind, when you say contract the one or the other or both?
Okay. Usually with HIV, because HIV is an infection of the HIV virus, so it comes into your body, and then it replicates itself in your DNA, and making more strands of the HIV virus. So, and then what happens then? It attacks the immune system. When it attacks the immune system, and it goes down, that's when other opportunistic disease come in, because now remember you are immunocompromised, so there's nothing that like fights infections. Can be your diarrheas, including TB. So that's when TB comes in. That is why usually they are sort of like friends. TB, it's like an opportunistic infection. It waits for your immunity to go down, and then remember it's airborne. Actually,
What is TB actually? What is TB? Because I know a lot of us get screened for TB. Do you cough at night? No. Do you cough up blood? No. Do you sweat at night? No. Oh yes. But we don't actually really know what are we getting screened for.
Okay, TB, it's an infection of the Mycobacterium tuberculosis bacteria. That's the name of the bacteria that causes TB. And remember, there's different kinds of TB. There's the most common one, which is the pulmonary TB, the TB that affects the lungs. And then there's the extra pulmonary TB, but that one, it's not that, well, it is common, but it's not that common as much as the pulmonary TB. So a lot of focus is put on the pulmonary TB, which is caused by this certain bacteria. That it's airborne, so you can get it from the air, or if somebody that has the bacteria sneezes and you happen to be around, you can catch that, and then it sits into your system, into your lungs. So here is the interesting thing. Most of us, especially us healthcare workers, because we interact with a lot of patients and people coming in, most of us people, we do have the TB within our system. We do have it. It's just that it's dormant. So it lies there and waits for the immunity to be compromised. Then it activates. So when it activates, that's when we screen you, and then we can detect it. And then because it's active. So if it's not active and it's dormant, it just lies there and it waits for such a time where the immune system is down, and then it comes up. So the reason why we always screen is because TB, remember, it still is the number one killer disease in the southern parts.
Number
of
one.
Africa.
So it's no longer
That is
COVID.
crazy.
Is COVID still there?
I don't know, we're over COVID now. We're over it.
TB has always been like a challenge, and the implications are just devastating. So that's why we are always constantly screened, because we're trying to. The thing is
Manage it.
about TB, it's curable. That's the thing. It's curable, but somehow we don't take our health seriously at times. So hence it's been there for quite some time, for decades. So it still poses a challenge.
So you get it the same way you get COVID.
Yeah, because it's airborne. Because it's airborne mostly. So yeah.
Okay.
I could be way off, but apparently there's also TB that you can get in other areas of your body.
Yes.
Your
that's
brain?
that's the
Your bones? Apparently.
Yeah, that's the.
It's apparent. I don't know. Apparently so.
Well, it's not apparent. It is so.
It is true.
Because, like I said, there's different types of TB,
Sure.
like you just mentioned, in the brain, in the spine, in the blood, in the bones. So we call that extrapulmonary TB. So that is TB outside of the lungs. So that one takes longer to treat, because the pulmonary TB takes about 6 months.
So I must be on medication for 6
For
months.
6 months, yeah.
That is wild.
Yeah, and then there's the extrapulmonary, which takes about 9 months, depending on how a patient, because there's a lot of challenges that patients come across when they are, when they are sick, and they have to attend clinics and stuff like that. So you find that it complicates. The 6 months ends up being 12 months, 9 months, longer
On
than
medication.
that. On medication. So,
I think I understand why people actually default,
Yeah,
And I know that medication for TB can be ototoxic, right?
Mm-hmm,
Meaning it can actually cause other issues.
Yeah.
I know you can lose your hearing because of them, because it's really harsh.
Yeah. It's
But
really
that
strong.
and HIV medication and whatnot. So what do then people do? If say hearing is a priority for me, do I just stop taking the medication and wing it? Kind of hope it ends?
Depending on the type of medication that you are taking, because for instance, if like you are diagnosed with TB and then you are started on TB treatment, and then somewhere along the road there's treatment interruption, default, it happens that you might now become resistant to that certain type of medication. So now it has to be switched constantly. So when they switch, it means now they're starting you on another regimen of TB. So those regimen have specific time frames. So the longer you are on that, then you can end up having those hearing losses and stuff like visual disturbances and
Sure.
stuff like that. Yeah.
So it goes to the other parts of the body and damages them in a way.
Yeah. Like if there's what we call multi drug resistant TB. I don't know if you've heard of it. Where now it's like a person has resistant strands to a number of the normal TB drugs. So now they have to go to the more toxic, more.
Sure.
I don't want to use the word toxic.
More harsh.
More strong.
Yeah.
More strong.
Type of regimen or pills. Yeah. So yeah, that's what causes
I
those side
didn't
effects.
know anything about TB, honestly speaking. I just know it affects the lung. And then I just like had, the only thing that I know about it was it's just like a terrible cough. That's the only thing I knew. But,
And night sweats.
Yeah. And night sweats.
Yeah.
I don't know.
Wellness Ace, have you never gotten screened for TB?
Myself. I've never got screened for this thing, but I've been in wellnesses whereby other people got screened. But for the other stuff, yes. I don't know. How do they screen for
TB?
TB, yeah?
Okay, like you are right, Hello. It's
I've been screened for COVID though. Tested where
It's
they
very-
put that long thing in your nose.
Oh, no.
Is that the same thing?
They just ask you questions
Oh, it's
and
okay.
trust that you are telling the truth, which is crazy.
Yeah. Sorry to disturb you. Yeah.
okay. There's so how you screen for TB is remember at school when they taught us the subjective and objective history taking.
Yeah.
So there are clinical signs and symptoms that you might expect to see from a patient that makes you suspect, okay, now let me screen for TB on this one. That includes loss of weight. That includes coughing, especially if you have been coughing for more than 2 weeks and it's a productive cough. Doesn't mean that if it's a dry cough, then we can, because remember there are signs, so you look for more signs. So there's drenching night sweats where like
Drenching.
yeah, drenching.
So
like when you sleep, you just wet the bed like
Horrible. Oh, not just sweating.
Profuse sweating, because the sweating would see
Kuyashisa, guys, it's hot. Yeah.
you can expect that, especially in summer. But now if it's like too much profuse night sweats, then you can think TB. Let me screen for TB. And then you come to the clinic and then we do a sputum test. Now there's even what we call a lung test, where we can even screen your urine. Take a sample of your urine.
Okay.
Then there's a certain test, we call it a lung test. And we screen for TB.
Is that where you dip it in?
Yeah.
So
For that one, mostly it's for diagnosing the extrapulmonary TB.
Sure. Okay.
Yeah.
So TB in the other areas.
Other areas.
Cool. Okay.
But it doesn't mean you can exclude, because you take also the sputum of just to exclude pulmonary TB. And then you take sputum, send it to the lab, it comes back. If it's positive, we start patient on treatment.
Okay. So
I don't know where were you going with having to ask if I got screened for TB.
no, I just want to know, like,
Oh, okay.
as an adult man in your 30s,
Yeah.
you have never got a screen for TB.
Honestly, I don't know.
As a healthcare professional, even.
Yeah, I've never, like, I know with COVID, I've done a lot of the COVID tests. Even with the screening, I mean, like, for the past 3 years, we've been doing that, like, almost
Sure.
every day. But then with the TB, yes, I have attended wellnesses, but then I've actually never got screened for TB.
Okay.
And actually, he just mentioned now that, like, the sweating. I got a cough at some time where I was, like, literally, like, coughing and, like, sweating, but I was not wetting the bed, but then it was, like, a serious sweat.
Yeah.
But then it got
Fever.
over after, like, I think I coughed for, like, a couple of days. It wasn't more than 2 weeks.
Okay, I think maybe you have been screened for TB.
Or maybe I forgot. Ne?
They just ask you questions
maybe,
after
yeah,
time.
maybe I have. Maybe I
Because
have.
those are the rules of employment. Like
Yeah, but we live in South.
when you are being
South,
We
employed.
live in South.
Yeah.
So,
Yeah.
Guys, come
No,
on.
probably. Maybe.
Yeah,
Probably
it's a bit
No,
tricky.
one thing I forgot to mention is when you are screening for TB, especially hence I'm saying in the workspace, like if you are newly employed, they do test.
Oh, yeah.
Medicals.
In that.
You would think that. You would think
Have you
that.
ever went for an X-ray?
Yes, in that case, yeah. In that case,
Exactly.
yeah. I remember
So-
they do the medicals. They do it, but they do like this general checkup of. They take your X-ray. They ask you questions if you have any.
So I forgot to mention that.
Yeah,
part.
see,
It's,
I love the fact that you guys think it
also
happens
used as
across
a
the board. I love it. I
diagnosis.
just can't say a lot, but
Yeah.
not as open as you guys would think. That's all I'm gonna say.
Yeah, but then I think for someone who's newly employed, then in that case, yeah, I think
Yeah.
correct. Yeah.
Yeah, and also random screens like every year they should be doing that by right.
Like annual screenings.
Annual screenings.
Okay.
Just to check with are you fine?
So without the relationship of HIV, is like the TB like that harsh, like when it came.
You could
Then
die.
I know there was a time when TB was a thing. I think in the early 2000s.
I mean, I think it's still a thing. I think people are dying from TB
Exactly.
a lot. A lot.
Exactly.
Yeah, but then I think after the COVID came, I mean, like the other diseases, they just died out. Everything was all about
That is
COVID,
actually
COVID.
true.
Yeah.
People are not dying from a lot of things anymore.
It was
That's
like
actually
only
very
like
true, come to think of it.
COVID, yeah.
Huh.
Come on, guys, that's not true.
No, it is. Everything was COVID.
No.
COVID.
Think about
Oh,
it. During
COVID
the
day.
lockdown, during the lockdown, everything was just like COVID.
No,
I don't even have flu anymore. Everything.
there was no
It's COVID.
There was no
flu.
pneumonia.
There was no
Just
diarrhea. There was nothing. There was nothing. Everything was COVID.
Come on, the shift was on COVID. Not that the other diseases were like, okay, let's give COVID a chance and see.
I really think we gave COVID a chance.
So people were still dying from other diseases.
Exactly. It's just that it was the focus was so
Was
much
not on COVID. Yeah. So people
So they were checking the numbers at COVID. They were not like bringing the numbers for TB and AIDS and diabetes and cancer.
But how were the numbers in a clinic setting? COVID times versus non-COVID times. Were the TB, HIV numbers still the same? Or did honestly the healthcare system really prioritize COVID now?
Yeah, I think that was the problem. The priority. Look, it was a shock. So
Pandemic.
it's understandable.
Sure.
So it was a pandemic, and people were like didn't know what to do, where to start, how to treat this. Yeah, it was new.
100%.
So hence the focus. And they were like, TB, we know, just give him TB treatment. This is what is.
Hold on.
focus. Yeah.
So that was the problem. Yeah.
Speaking of
yeah.
speaking of tests, right? Because remember we were talking about both TB and HIV.
Yeah.
HIV is a very interesting thing, I think, for young people. Well, at least for myself, right?
Okay.
From the looks of it, people are not necessarily scared of getting HIV. I'm going to tell you what I mean by that.
Okay.
And that's why I want to elaborate so I'm not misunderstood. So I think we are all aware that young people are very inclined to have unprotected sex, right? For a number of reasons that I don't want to get into because I don't know all of them. But people are really scared of getting pregnant. That is like, if I get pregnant, I will die, right? I'm a mom, guys, so I really won't. But in terms of pregnancy versus HIV, people are just more inclined to be scared of pregnancy.
What about the other things that are there?
I mean, those we can deal with. A baby.
So people are more worried about the baby. than the other things that are there.
I promise you, people actually are more inclined to take a pregnancy test than an HIV test after unprotected sex. The numbers for HIV testing are very low. People don't test. Particularly men. Men do not test as often as women.
Man, yeah.
Is there a reason why?
I don't know why we guys we don't like to test, but there's still that misconception, if I
Sure.
should put it like that, would see like HIV or what you don't know can't kill you.
But it will.
Well,
Let
Yeah.
me
so there's still that, and the fact that if you test and you know that you're HIV, then it's a death sentence, which is not the case if you take your medication properly as prescribed by your doctor or clinician, by your doctor and your nurse clinician. So I think that's why most men don't test, but some women also have that fear. Yeah, well, there is still that stigma that comes with HIV. Bazotin. You feel like uhamba, you're walking around naked, like it's written.
It's written on your forehead.
Yeah, well, Kanti, it's not the case. It is not curable, but it's definitely manageable.
Manageable.
And I think now a lot of activists that have come up on social media and on TV have really shown us that it is possible to live a normal life, you know, being infected with the HIV virus, right?
Yeah.
So what I would like to know is, are there different, because you said for TB there's different treatment drugs.
Yeah.
Are there different ARVs for HIV depending on the person, or is it a one size fits all?
They're different.
Are they different?
They're
Okay.
different as well, and also it comes back to the issue of issues of adherence to treatment, defaulting, treatment interruptions, then which now makes the treatment to be more complex. But as soon as you are diagnosed with HIV, we start you off with one pill which consists of 3 drugs inside of it, and then it's a very good pill that has shown so much effectiveness, and it can bring down the virus in a month. It can just bring it down from however, if you take your treatment accordingly as prescribed and you don't interrupt. So yeah, we also screen we do a blood test to check the kidney functions, because some of the drugs, you know, they tend to be so harsh on the kidneys, and then it can endanger you to go into renal failures. So if we find that okay, your kidneys are a bit, then we can change the drugs.
Sure.
Yeah, so we just play around with the drugs.
So there's a notion that if someone is on the drugs, right? Because remember, we were taught, and I still think this is true, that you cannot tell that someone is HIV positive just by looking at them, right?
Exactly.
But apparently now you can tell if people are on ARVs, because apparently there's, you know, like the lips, something happens with the lips, there's weight gain in certain areas. Is that a misconception?
With the new drugs, with the previous drugs, when HIV started, yes, there were some like
Telltales.
yes, but with the newer drugs, no, there's no telling.
But
There's
then
definitely-
what if the weight gain is because I'm eating too much?
Exactly, that's what I'm saying. Good.
Or the mouth. You said you're talking about the.
No, apparently there's like, what is it, like discoloration, eh? Like,
But what if the discoloration is because I'm smoking too much or drinking too much?
Exactly.
hi, bo, wellness is a crime. I'm just telling you that people in the streets, people in the streets out there are saying, how?
No,
Yeah, I'm also like just coming on top of that.
Yeah.
And like, hey, yeah, okay, yeah, but maybe.
No, look, when you start on treatment, there are certain side effects that you might experience, but they usually die out
Sure.
because that's when your body is, you know, getting used to the new treatment. But then once it becomes a habit, the remarkable system, the human body like adapts, and then you can't tell if I'm taking ARVs. Wherever. Yeah.
But I think it's
Some we differ also as human
Sure.
beings. Some I can take them and not gain weight. Some take them and gain weight.
Yeah.
So I can take them and not have any diarrheas or rashes. That's what usually happens when you start. Some they just take, but most it doesn't happen anymore. Nah, it
So what
doesn't
would be the possible reason for the weight gain, if ever it's like that? Is it something that we can say when you're taking ARVs you're gonna gain weight, or it's something maybe it's because now it has to do with the urge for wanting food. Maybe the medication makes you more hungry,
Like increases
or
your
something
appetite
like that.
almost.
Yeah, something like that. I think maybe it's along those lines. What do you think?
Yeah, it is because some of the side effects, it will tell you, even if you can go to your Google, it will tell you it's okay, you might experience weight gain.
Weight gain.
From those are the side effects, minor side effects of the medication.
Yeah.
But like I'm saying, I'm an ectomorph. Like it's hard for me to gain weight by nature.
Okay.
So
Must be
yeah,
nice.
it depends. It is nice.
Yeah, I mean, it must be very nice. I'm like, yeah, it must be very nice
so weird.
to be on
Yeah.
that sort of spectrum.
Yeah.
But also, I wanted to find out, because we're talking about the side effects, like, they minor, it's not. But now we live in communities. Now we live with other people. And I know in the Black communities, people find the need to just comment. People just
Say
say
anything
stuff.
about
People say,
anything, yeah.
Can you not police
gain
why
yourself.
you getting the weight? Do you know what I mean?
Connection, those-
Yes, already you are getting like, are you on that? Eh? Yeah, bo, that is a problem. And I think that actually causes the stigma because people comment. And I think because people, when there's a bit of weight gain, you're either on contraceptives or ARVs or something. You can't just be happy and gain weight.
Yeah.
Doesn't that stop people from wanting to go get medication or get treated?
Look,
Especially in like
Community.
the Black community.
myths and misconceptions are very dangerous and very powerful.
Sure.
So they shouldn't be taken lightly. It's just all about informing, giving people the knowledge to know this and this is what it is, not what you think it is. Yeah. Because people perish because of lack of
Hey.
knowledge.
Amen.
Yeah, that's what the Bible taught us long time ago.
Hallelujah to that.
Yeah.
So get yourself
Informed.
educated. Yes, informed about these things. One I'm really curious about. Right? And again, I'm hearing it in the streets, guys. I know this is a very sensitive topic. I'm hearing it in the streets out there. That people are on PrEP, but full time, because you never know. You never know. Life is very unpredictable. So people are on PrEP full time. So I want us to actually talk about what PrEP is, right? And why people go on PrEP normally, not what people are doing with it.
Okay.
And also why people are going on PrEP all the time. They're just taking the pill once a day, like hypertension medication, just to be on the safe side. And also, what are the consequences of that, if there are any?
Okay, there's PrEP and there's PEP.
Sure.
Oh, there's two things. There are
Yeah.
two different things.
There's two things involved.
Okay.
There's PrEP and there's PEP. So let me start by PEP.
Okay.
PEP is post-exposure prophylaxis. So this is when like the damage has been done. So now we are trying to like damage control.
What do we mean by damage?
Okay. I sleep with somebody whom the status I don't know, or maybe there's a condom best, and then I don't know the status of this person. So within 72 hours, I can rush to the clinic and say, hey, look, I was at a party on Friday, and then I saw this beautiful lady. Then one thing led to another. I took her home, condom best. I don't know this person. I don't know her status. So can I have some PEP?
Sure.
So that is what PEP for, because now you've already done the deed. So you take PEP, which is basically the ARV for 28 days, which is a month.
Okay.
So you take just to prevent the virus from replicating inside. So for it to die down and not get a chance to replicate and do all those funny things. So that's PEP.
So it's a cure, technically. Because then the virus has entered the body.
Yeah.
Is it like a
I
morning
don't,
after
I don't
pill?
want to say it's a cure.
It's a
because
morning
remember,
after pill for
It's a morning
HIV.
after-
Yes, it's a, yeah. Hey,
I think in simple terms, yeah.
it's a morning after pill for,
But for HIV.
For HIV.
Okay.
So whether or not you were going to fall pregnant, you just know chances are you're not going to be pregnant.
Exactly.
Whether or not you were going to get
Right.
HIV,
Not 100%,
you stop.
right?
Yeah. Oh yes,
No,
that's
if
such a
not-
good question.
if it's within the 72 hours,
It's a short thing. 72
yeah, it's,
hours.
Yeah, 72
Is it a
hours.
short thing like
Because
like
then,
100%?
with the morning pill, 72 hours, hey, there's a lot of people who trusted that pill and hey, today we're talking
From
something
where? A
like-
lot of people from where?
Yeah?
A lot of
the
people-
streets. I've heard it from you saying the streets are speaking out there, you know.
Guys, don't corner me to say it's 100%. So I can say it's
But the people want to know. We want to know.
99.99.
999.
Yeah,
That's
let's leave that 0.1.
So you mustn't be quoted, ne? To say,
I
hey,
don't,
he
I
said
don't
it's
want to be quoted to
100%.
say I said no. So that's PrEP. So
Okay.
PrEP now, PrEP is like I'm a guy, obviously sexually active. I have multiple partners. So let me protect myself. I'm not condoning that, by the way. I'm not condoning. Actually, I'm discouraging that. We shouldn't have. We shouldn't be having multiple partners that we sleep around with without protection. That's you are applying for danger. So PrEP actually it's pre-exposure prophylaxis. So before. So you take the medication so that in case it happens, or maybe your partner cheats and stuff like that, then you at least be safe because we are protected
I just.
from there.
So
why is
your
that
partner,
drug
if in
important?
case your partner cheats, so there's this expectation.
Yeah, but the
Yeah,
problem.
If she cheats, now I'm drinking them full time.
Why is that drug made? Why are we like? Why is it a pre thing? Like,
So people are not
I
afraid
think
of-
I might get into a
there's
situation where.
gonorrhea, guys.
That's
Oh,
the
wait,
thing.
yo, that's what you don't want to. You don't want to come to that side of town.
That's the other part that people
It's gonorrhea. I'm saying gonorrhea. The so-called drop.
yes
People
yes,
in the township, when I was growing up, it used to be called e-drop.
Is that what that is?
Yeah. And I have like a special
Yeah.
question based on e-drop, and I'll ask you later. Please
Okay.
just remind me. Yeah.
okay
On e-drop
The streets
itself,
today
I think
actually
it's also
are
related to what
reference.
we're speaking about.
yeah, it is I mean HIV it is widely and sexually transmitted, so
Yeah.
is gonorrhea. So the problem now is people take PrEP, they're only focused on HIV. They forget about the other STIs, gonorrhea,
Herpes.
syphilis,
Aren't those curable?
chlamydia. They are curable.
Oh, then why am I stressing about something
Aye,
curable?
but
No.
I get it.
Herpes-
This one is the
I
one
know-
that's not curable.
I'm definitely sure herpes doesn't have a cure.
Yeah,
You can live with it, and it might not affect you, but
but it doesn't
it
show,
can be-
ne?
yeah, sometimes there's people who
Guys,
don't
guys.
show the
Ah,
symptoms. but
okay.
it
One, why does it
I
seem
get
like we
I'm
are
being
condoning
I'm
this?
being no, I'm being like the devil's advocate. I'm telling you because
No.
I'm trying to give you the opinion of a lot of people to go,
Yeah,
but it doesn't,
yeah.
if it doesn't show,
No,
then
but
why?
you're like, Moses curable.
No,
so-
guys. I'm
No,
all for
but we are
safe sex,
representing also
one
the-
partner, but I'm like presenting everyone's opinion. Because there's people that really feel like
Yeah.
if you can't
Oh,
tell,
okay.
if I can cure it, let me stick to things that I can't cure. Let me try stay away from that. If I can take a pill for my 6 months, Yana, and I'm back to normal.
It's the streets.
It's the street.
Yeah,
People are in the
but
street.
then if you abuse antibiotics, because those ones are bacterial infections, so if you abuse antibiotics, there's gonna come a time whereby you will be resistant to those antibiotics. Then you would have to go for stronger.
Can you be resistant to PrEP?
PrEP.
Like
Is
no, I'm saying antibiotics.
Oh, not PrEP.
As in
So-
for your gonorrheas and your
Sure.
syphilis. So I'm saying if you abuse that thing, be like I can still sleep around. I'll catch gonorrhea there, and then I'll treat it.
With
I'll catch it there.
antibiotics, yeah.
You'll end up being resistant to the antibiotics that are readily available. So now you would
Okay.
have to go for much stronger, much more expensive drugs.
On much more detrimental, I would imagine, to
Exactly.
your body.
So the stronger the drug, the more detrimental it is on your body. So
Does anything happen with PrEP with long-term use?
yes, kidney function. Yeah, kidney function test. We do it routinely just to check it's okay, because they are quite strong. Some, like I'm saying, they can be quite strong on your kidneys. You find that now people have renal problems, so we constantly check that so that we know which drugs to switch you at.
Okay.
Just play around with the drugs like that. So yeah.
And before we wrap up, actually, I wanted to talk about taking medication, right, for HIV, because I think it is widely known now that you can get to a point where your CD4 count is really good and it's not traceable with like rapid tests, right? Hi, it happens out there in the world where
CD4, I'm lost.
no. Like if you're taking a test, then you test negative, even though you're HIV positive,
Oh,
because
okay.
your immune system is fine. Like your CD4 count is good.
Is it about those people who are resistant to HIV? I don't know. There's
Not
something-
resistant, but say I'm HIV positive and I'm taking really good care of myself and I'm taking my medication, and I take a rapid test.
Oh.
Yeah.
And I know for sure I'm HIV positive, but it comes back negative. Like a rapid one. I'm not talking about bloods. Nah? Why does that happen?
Well, it happens if like you've been taking your medication for quite some time, and then the virus in your body is so low because the drugs are working in your system. It's so low to a point where it's non-detectable. Doesn't mean it's not there, but it's so low, like it's almost undetectable.
Can someone contract it from having sex with me if it's non-detectable?
There's still a chance, but very limited.
Let's talk numbers, like
That's
0.003,
Yeah, 0.
10%.
Yeah, 0. But look, it has been scientifically proven that, let's say me and you are both HIV positive and we are on treatment and we test undetectable. There is 0 chances of us bringing a positive baby.
Okay.
So it goes to, can you give it to
Compliance.
someone
Yeah.
else?
So probably not.
So if you are taking your treatment correctly, this one I can say with confidence, if you are taking your treatment correctly and the virus is so low, it's undetectable, and there is 0 chances of you transmitting.
Consult.
To even your baby,
Transmitting.
right? To
Yeah.
even your baby.
Yeah.
There we go. See, and you can live a normal life with
Yeah.
HIV.
So hence abo PrEP and abo PEP, they come in handy because, if we are envisioning an HIV-free time, that goes for TB as well. That's why there's so much focus on TB. So because if I'm on PrEP, you can't, the heart wants what it wants. So if I see a lady and I want that lady and find which HIV positives, and some people, they still go.
It's really not that
and
dramatic,
love the
like-
person, because
Yeah.
it's not like once you must so HIV, you don't deserve to be loved. No, it's just
100%.
a condition, an infection that you have. You have. Someone is like, no, guys, that's the stigma that.
That is
people
stigma,
should know.
actually.
Yeah.
That is stigma.
That is stigma, and so PrEP. When I'm taking PrEP, then I can, and my person is positive, is taking ARVs. Then we are safe. We can even bring a kid that is negative. Everything is fine.
Sure. And on the market now, there's this new test. I've seen this personally, and I was shook for lack of a better term. They are oral swabs. You swab your buccal areas and then you put in a solution thing. Apparently that can tell you whether you're positive or not. It seems dodgy. It seems dodgy because there's no blood. Like you do this. And they sell them at our popular pharmaceutical retail stores.
No.
Okay.
And then you do this. Then you put in the thing. And you
there
wait
is a-
I
results,
can't remember, 5 minutes or so.
Yeah.
And then it tells you one line, 2 lines, and you're like, oh, okay. And then,
Yeah.
but that sounds like a scam. I'm sorry. I just don't. There's no blood, nothing. Something contour off.
I mean, I will not speak on that. I've never seen it. No, I don't know.
They're in
Is it something that you
pharmacies.
guys
They're
don't
in
use in the
pharmacies
clinic?
right now.
No,
Is it something that you don't use in the clinic?
no, we do a rapid test or ELISA test.
Oh.
Yeah,
So is blood the only way to test for HIV?
that's what we do at the clinic. So,
Sure.
maybe some
it's
other
there, maybe.
more advanced countries, they might have
Something
more
like that.
ways of detecting.
We are third world country, guys.
But-
I don't think we're that advanced.
But as we stand, to know we test blood because we believe it's through blood to blood contact.
Sure.
That's how you can. Or some other. So saliva,
I know it has like traces if you're HIV, but not enough apparently.
exactly not enough for us to test and detect. But maybe they are advanced. The private was it a private?
It's, no, it's not private. They are sold in pharmacies in South
pharmacies.
Africa. Anyway, I don't know if it's anyway,
The
but
well-known
where I live, they are sold.
pharmacies,
So, yeah.
I think I've
But
heard
then-
about it, but I've never seen it or used
No,
it.
I've seen it. Like it's I'm not saying maybe someone said I have
Yeah.
seen it with my eyes,
Yeah.
and I've seen
What's
the
the name of the
lines
test?
with my eyes. I can't
It just,
remember.
it just to do with the saliva,
But it's a-
apparently.
You do
Yeah.
this. You do this, guys. That thing looks like a spoon, and then you do this,
Okay.
and you
And then
put
you
it
get
in.
the results right away.
Easy.
I just know about the transferability, the what you call it, the saliva, that you need 5 liters of saliva to
Exactly.
transfer,
Exactly.
like HIV. So
Just for you to
Yeah.
detect HIV. So,
to detect it,
3 liters of saliva. Did you say 3 liters?
5. I think
5.
it's 5, right?
Yeah.
Yeah, I think that you
Like-
need 5 liters to transfer it. So like I think
At
there was
one
also,
go.
Yeah,
Yeah.
there was also this.
Hi,
Also, I don't know if it was a
Bola.
misconception around having to kiss, to say like people were now also, when the stigma was very high, to say hey, also kissing could be a chance to transfer like a.
But remember, we were told if you eat from the same spoon. I remember back in the day
so
when
I
there was
think
still
that's to do with
advertising
that.
and all that.
Yeah.
You can't
those
contract.
are misconceptions. But maybe if maybe you have a cracked lip,
That's when
then
chances are they.
depending on how vigorously you are kissing. Yeah.
So even the intensity, guys, clearly it
so
comes
you
with
might
something.
suck some blood there and
Oh, Mudimu.
ingest it on
Ingest it.
yourself and yeah.
Yeah.
And again, it depends if ever you have an opening inside, because then otherwise the virus might die out in the digestive system. Ne? Because I'm just thinking, if ever you swallowing the blood but you don't have any opening, you can still survive, right? I'm just thinking.
So you're saying you're kissing someone and then you suck out the blood.
Yeah.
And then,
and then
but
it
you
goes
don't have
in-
openings in your
it's
mouth,
in your
and you kind of
mouth,
swallow
yeah.
the blood basically because you
and then
swallow.
if don't
You're
have
kissing, you
anything
swallow
outside, I
the
don't know if
saliva.
It goes deep to that.
Does your
Yeah.
Would you like to try that and see if
and let us know
Of course
it
not. I'm
works,
just thinking
no.
deep about what we're speaking about.
I know. No.
that your stomach like acids sort of dissolve
Probably you
it.
have a cut along the esophagus.
Hi, Bo, wellness.
I'm just
Center.
thinking deep.
Yeah, you might have cuts and
Yeah.
whatnot, or ulcers.
Yeah.
It gets a bit more complicated.
Yeah,
maybe.
it is. It is. It's not
But
just.
I think people should not have the stigma also around like kissing. I mean, like people go on dates and
Yeah.
then they kiss. So are we saying people say mwah?
No,
But then you talk about
guys,
vibrant-
kiss.
But also
Must kiss,
remember,
you know?
we're gonna now delve
But-
into
But just
STIs
check
and
if there are no
STDs.
mouth sores and stuff.
Yeah.
Sorry, so open your mouth. I want to see if you have mouth sores. Because
Imagine that. in a
that's not a
date.
normal. That's not a normal conversation.
Yeah.
But you know what? I think this is definitely one of those conversations that need more than an hour.
Yeah,
It needs more
definitely.
than
Because there's a lot to unpack, right? There's a lot to unpack. And then there's also now the side of STDs, STIs, that we definitely would like to speak more about. But because we're out of time, Thabo, where can people... I know time runs when you're having fun. Is that the saying? Time does what? When you're
Time
having fun?
flies.
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 I can't believe I said run.
I had a
So,
question for him though.
Sure,
Are we
okay.
at the end already?
we're at the end, Shem. We
I don't
are...
know what I said. You guys should remind me.
Gonorrhea, drop.
Gonorrhea, it drop. Yes, when I was growing up, there was this conception, when you're having a drop. I don't know if it was an alert to say people should not like practice unsafe sex to prevent them having to go to the clinic. Ne? They said when you get a drop, you go to the clinic, they're gonna put your penis on top of a table and the nurse is gonna hammer it to heal you. So like, there was that. Like, honestly, like when I was growing up, there was that.
Can I ask where you grew up? I'm very curious. So where's home?
Umkhaya wam lona, we come from the same.
Is that what the saying that was said there? That you'll be hammered?
I think when we were growing up, they used to say a lot of this. I don't know from the guys.
I heard.
I'm from Gauteng, guys, and
I heard of it.
You've heard of it, ne?
I've heard
Before
of
maybe
it.
we get into academic stuff, they used to say, obviously when they used to describe gonorrhea, to say gonorrhea is like this, but when you go to the clinic, they're gonna put it on a table and then to heal it, they need to hammer it.
so for the females, because gonorrhea is also
No, for guys, obviously, because I think it was like around guys to say
Okay.
they're gonna hammer it and then that's how you're gonna get healed. That's the way to heal it. So it's just like I don't know if it was maybe the elderly people trying to warn us to say, you know what, do not ever try to practice unsafe sex because you might get this and this could be the possible treatment or intervention that's gonna happen there. I'm just imagining, yeah. So I don't know, like that. What do you have to say around that? Like with maybe the young ones who are growing up, the teenagers who are also maybe probably having that conception because people don't know.
No, that's wrong. Hammering will not cure. Remember, it is a bacterial infection, so it needs antibiotics to clear it out. So you need to go to the clinic as soon as you have signs and symptoms of it. And then you get your prescription and then treat it.
Yeah.
There's no hammer that can hammer it away. Can even hammer it more.
Yeah, no, we definitely do deserve like a part 2 of this. Like,
We do.
there's more. There's more.
There is a
I
lot.
have like a lot of questions from from our viewers as well. And I don't think we got to actually address some of their questions.
Okay.
But then we definitely do need a part 2.
we do. We also need a part 2 when it comes to like disclosing now, when it comes to disclosing your status and whatnot, because those are important things. And apparently there's like legal implications
relationships as
to
well.
things like that. So I think we definitely need to have a part 2. But Thabo, where can we find you on the socials?
Okay, at the moment, I'm not active on socials. So when I do, then I will let the team know, and then people will find me there.
All right.
Yeah.
Interesting. There's still people in 2024 that are not on socials. You're a unicorn, Thabo. You're a unicorn.
Yeah. Thabo, do you know Katy Perry?
Yes.
Listen, we're not going to do that. This week we are not doing that. Do you know Taylor Swift?
I got butchered.
Taylor Swift.
Was it Taylor Swift?
The fact that you got the name wrong tells
I
us.
still don't know. But then, do you know Taylor Swift?
Taylor Swift, I know. The musician.
Yeah.
But see, we should actually have a competition based on this because I am very worried about you.
Yeah.
But guys, thank you so much for joining us for yet another beautiful episode. And Thabo, thank you so much for gracing us with your knowledge and your presence. And from myself and the team, it's goodbye.
Salute. Thank you for having me, guys.
That was nice.